I'm Rob Wilson. Thanks for joining me this week for Employco's HR Chat. With me, as usual, is Jason Eisland, our Vice President of HR.
Hi, everyone.
So the topic this week is, Jason. A lot of employees have delayed their medical treatment, whether they're sick or something might be wrong with them. They've delayed it because either one, elective surgeries for the longest time weren't an option, and then people just did they feel safe? Did they not want to go to the doctor? Did they not want to be exposed? And so now, when people are finally addressing their medical needs, they're finding that maybe they're sicker, or if they had cancer, maybe it's further along than if they would have went 6 months or a year ago, and that's impacting the level of claims and your overall health costs, I think, in the future.
Yeah, so I mean, some of the stats that we're seeing, cardiovascular disease, the new diagnosis cases of those are down 30 to 40% over this last time. So it's not that people are healthier and having less cardiovascular disease, it's just being diagnosed less, which is definitely going to be kind of a trickle down in the future, affecting people's health and claims in the future. Cervical cancer screenings are down 15%. Colon cancer screenings are down 25%. And obviously, the later you get diagnosed, the kind of the worse the outcome will likely be.
I saw an interesting stat too. And so it's not just about your cancer diagnosis and stuff, but COVID via the lockdown and people working from home, being home all the time. 42% of the respondents gained weight, and the average weight gain was 15 pounds.
Yeah, I mean, there are some habits, either coping or just less exercise, or it could be a variety of reasons. But yeah, people have been unhealthier habits and behavior during the past 12 months.
Yeah, you couldn't go to the gym because it was shut down, or in Chicago here, you're not out walking in the winter with the snow that we had, and that was a pretty good sized weight gain, and even 10% of the respondents gained more than 50 pounds. So that weight gain obviously is bringing stress to your body, and so it's going to be a big push to get people back out into corporate wellness plans have to be more important now than in the past.
Yeah, so many employers are concentrating very primarily on getting employees back to work and the logistics of the office and masks, but I think equally so mental health and physical health and getting the employee well-being back to where it was pre-pandemic, or kind of shooting for even a higher result should be as important as kind of the logistics of kind of returning employees back to the work.
Any tips for companies that are bringing people back, and how to if they don't have a wellness plan, how to kickstart one, and or how to send that message out to not just the wellness of losing weight and exercising more, but going for checkups and making sure that if you had any issues over the past year that you address them now.
Yeah, some employers, some of our clients are making kind of almost like a gaming competitive, like departments against departments, and walking challenges, and make sure you get your routine physicals and well woman exams, and providing incentives. And the team with the most points are going to get a kind of a financial prize at the end of the year. So there's kind of some cool creative ways to get employees energized and back kind of enthusiastic about their physical and mental health, and being back to work as they were pre-pandemic.
Do you spread the word via newsletters or a wellness newsletter, with the fact that you're under the ACA? Most health plans, if it's an annual physical, it's free. They don't need, there's no copay even.
Right. I mean, obviously during the pandemic, people were delaying it either because it was forced or just comfort and safety. But now, yeah, I mean, it's free. Get in and get your preventive annual exam, get those back on track, and catch things sooner.
And if you need tips or suggestions, feel free to reach out to Jason or myself. Happy to have our HR team that Jason leads to help give you some suggestions or samples and ways to kickstart a wellness program, and make sure your team's healthy as you go, as everyone's coming back to their office and workplace. So happy to
Yeah,
help in any way.
feel free to contact us, hr@employco.com, or our LinkedIn page. We're here to help.
Great. Thanks a lot
Thank
for
you.
joining us.